Your blood pressure is 140/90. Should you panic? Is it still normal? Or is it a sign that your heart and blood vessels are under too much pressure? This is one of the most common questions people ask when they start checking blood pressure at home. The problem is this: many people look at one number and immediately feel scared. Other people see high numbers again and again, but ignore them because they feel fine. Both reactions can be dangerous. Blood pressure is not about one single reading. It is about your pattern. In this video, we will explain what numbers like 120/80, 130/80, 140/90, and 180/120 really mean. We will also explain when you should keep tracking, when you should talk to your doctor, and when you should seek medical help right away. Let's start with the most familiar number, 120/80. For many adults, this is generally considered normal. The top number is called systolic blood pressure. It shows the pressure in your arteries when your heart beats. The bottom number is called diastolic blood pressure. It shows the pressure in your arteries when your heart rests between beats. So when you see 120/80, the top number is 120 and the bottom number is 80. But here is the important point. Blood pressure changes throughout the day. It can rise after exercise, stress, or caffeine. Poor sleep, pain, talking during the test, or sitting in the wrong position all matter. That is why one reading is not enough. Now let's talk about 130/80. Many people are surprised to learn that in the United States, blood pressure that is consistently at or above 130/80 is considered high blood pressure. The word consistently is very important. One reading of 130/80 does not automatically mean you have a serious problem. But if your readings are often around this level, it is a signal to pay attention. This is the early warning stage. This is where tracking, lifestyle changes, and early prevention can make a real difference. Now let's talk about 140/90. For many years, people heard that 140/90 was the main number to worry about. And it is still an important number. A reading around 140/90 is not something to ignore, especially if it happens repeatedly. It may mean your blood pressure is high enough to increase stress on your heart, brain, kidneys, and blood vessels over time. But again, do not judge everything from one reading. Ask yourself, did I rest for 5 minutes before measuring? Was my arm supported? Was the cuff the right size? Was I talking? Did I just drink coffee? Was I anxious? Did you take 2 readings 1 minute apart? Many high readings happen because of measurement mistakes. Repeated high readings should be taken seriously. This is exactly why home tracking is so useful. You are not trying to scare yourself. You are trying to understand your real pattern. Now let's talk about 180/120. This number is different. If your blood pressure is around 180/120 or higher, you should not ignore it. If it stays very high, or if you have chest pain, shortness of breath, weakness, confusion, severe headache, vision changes, or other serious symptoms, seek medical help immediately. This video is educational only and is not medical advice. But very high readings with symptoms are urgent. Why do these numbers matter? Because high blood pressure often has no symptoms. You may feel completely normal. But over time, it can silently damage your body. It can increase the risk of heart disease and stroke. The goal is not fear. The goal is early detection and early prevention. At Miland Wellness, we believe the first step is simple. Track your numbers correctly. Use a simple 7-day record. Check in the morning and evening. Take 2 readings each time, about 1 minute apart. Write them down. After 7 days, you will have a much clearer picture. Your doctor can see whether your numbers are only occasionally high or whether there is a repeated pattern. This is much more useful than saying, "My blood pressure was high once." Let's make the numbers simple. Below 120/80 is normal. 130/80 is high. 140/90 is a stronger warning. But remember, your personal target may be different. Your age, history, and medications all matter. Use this video to understand the numbers. Use your home record to start a better conversation with your doctor. If you check once and see 145/92, do not immediately panic. Sit quietly. Make sure your back is supported. Keep your feet flat on the floor. Place the cuff on your bare upper arm. Keep your arm supported at heart level. Wait 1 minute. Measure again. Then write both readings down. If this happens repeatedly over several days, contact your doctor and share your record. This is much better than guessing. Another example, If your morning readings are often higher than your evening readings, that pattern may be important. If your readings are always high at the doctor's office but lower at home, that may also be useful information. If your readings look normal during the day but high in the morning, your doctor may want to know. Patterns matter. That is why tracking matters. So, is 140/90 still normal? The practical answer is no. You should not treat repeated 140/90 readings as normal. But don't panic from one reading. Measure correctly. Track for 7 days. Look for the pattern. Then talk with your doctor. At Miland Wellness, our mission is simple: early detection, early prevention, better conversations with your doctor. If you want help, use our free blood pressure tracker. The link is in the description. Know your numbers. Don't guess. Educational only, not medical advice. If your reading is very high or you have chest pain, shortness of breath, weakness, confusion, severe headache, vision changes, or severe symptoms, seek medical help immediately.